Good afternoon. You are with Tulip Nak Sompop Lao, and we're gonna give you the update of what's happening since last night until today, including the latest number of infections officially reported by CCSA at the press briefing that just finished about over an hour ago. So let's go over the headlines of this edition for a little bit. Thailand records 309 new infections today, mostly from proactive screening. And yesterday we had a chance to interview the education minister because we heard the news that the school will be in 28 red zone provinces will be allowed to have on-site learning starting February 1st. So we had a chance to talk to the minister with that, which I think some information we got is very interesting, and we're gonna have that for you. And also Bangkok eases restrictions on 13 types of business starting today, and 50,000 doses of AstraZeneca vaccine to arrive in Thailand next month in February. So that is pretty soon, actually. Let's start off with the first news. We're going to go to the press conference by CCSA. Like you can see, the total number of today is 309 and no fatality. So bringing the country's total to 13,104 cases. And there are over 2,800 people currently receiving treatment, including 10 in a severe condition. The Dr. Twisin, which is a spokesperson for CCSA, said that the high number of new cases resulted from the proactive screening, which found 217 cases. The 12 imported cases are from Lebanon, United Kingdom, Estonia, United Arab Emirates, Italy, Sudan, Switzerland, Sri Lanka, and Germany. Samut Sakhon is still a center of the current outbreak. The youngest new infection is a 4-year-old girl. Over 5,000 cases have been found in the province, followed by Bangkok and Chonburi. They now have 648 cases. Dr. Twisin said that Bangkok might see a rise of infections number in next few weeks, resulting from proactive screening in areas where a lot of factories are located, especially the factories that they found infected cases before. The spokesperson said he gave the warning at the end just to make sure that everyone realized that we are living with the virus. Everyone is at risk and everyone can get infected. So everyone must wear a mask, wash their hands frequently, and keep their distance. And also try to write down where you have been in the past 14 days, or just use a tracing application that the government is trying to support or trying to ask you to use. They say that there will be no legal charges if you not use it, but you will get legal charged if you conceal the information. So now let's go to the next news. The next news is the interview we have with the education minister yesterday, which I think is quite interesting. We got a lot of good information going on with the minister. Let me see, where can we find it? I actually have I actually have the video of the interview, but let me see. I want to show you where the prime minister, not the prime minister, the minister that was talking to us. Yesterday afternoon, we went to the education ministry and we have about half an hour conversation with the minister. And it went pretty well. And there you go, I found it. It went pretty well. We did half in Thai and half in English, pretty much similar kind of similar kind of information, but I think it's interesting because all of this will apply to the international school as well. So here is the minister, the conversation we had yesterday. I'll show you in a little bit, maybe a little soundbite. So he said that school in Thailand's 28 red zone provinces will be allowed to resume on-site learning from February 1st. The Education Minister, Nattapon Thipsuwan, said that the outbreak is under sufficient control, whereby the ministry feels comfortable enough with the safety measures in place for classroom lessons. Nattapon said that if the number of infections rises again to between 500 to 600, then the ministry have to reconsider the measure. So far, officials have been able to trace and understand the timeline of each infection, which gives the ministry confidence that they will be able to manage the situation in schools. The ministry had extended this before the closure from mid-January because there were about 50 million people traveling around the country during the holidays. So they limited school activities for 1 month as a precaution. He said the number of new infections has been quite stable since January 17, and the trend which provides a level of confidence to the ministry. Though the school in Samut Sakhon province, however, which is still the center of the outbreak, are likely to remain closed for the time being. The ministry also plans to let all students progress without taking final examinations. Nattapon said that the pandemic make it very difficult to adhere to the standardized test. And many countries around the world have allowed such measures already. He hopes that this will enable teachers to focus more on students' individual abilities. Now, there's a question of a lot of people. If you let the students move up to the next class so easily, would that affect anything? Like he said, this generation of students, the whole world is experiencing the same thing. And he said that in the reality, if there is any students that couldn't pass the standardized test, at the end they do the retest, and then at the end they will get to progress to the next class anyway. So he hoped that doing this will enable teachers to focus more on students' individual ability. Hopefully that will be the case. Now, 2 days ago, I reported to you that the World Economic Forum has released the Global Risk Report, detailing a lot of things, how pandemic affect the economy, the world economy, and they focus a lot on the education, actually. Last time when we talk about this, we give you the overall picture of the effect and what will be the highest global risk. They talk about number of fatalities, they talk about economy, they talk about the inequality gap that keep widening, and they're detailing how much pandemic is widening the inequality around the world when it comes to education accessibility as well. So Nattapon said that his ministry is quite concerned about the dropout rate, especially for girls. The ministry has teachers in contact with families of such students so as to understand their reason for not letting their children go back to school, and have been addressing the issue. So he said it's working pretty well with what they are doing. Nattapon admitted that online and offline methods are still one of the ministry's main concerns because on-site learning is still the best approach. In some schools, however, online education, he believes, has helped students to organize their time and receive more direct knowledge from the educators. The minister said that he is planning projects to ensure that schools in rural areas will have access to technology. He said that these projects will take time and budget planning, which the ministry is preparing for the end of this year until the beginning of next year. The master plan, he said, will be finalized in next 3 months. It will be a master plan for 5 years. Many small schools will be consolidated to one larger institution to maximize the resources, with the smaller schools in remote areas will receive more funding. The decision, he said, will be based on the data provided by the local officials. The ministry promises, I asked him the question because we heard news often enough that there are some students in the rural areas that they have to walk for like an hour, 2 hours, 5 kilometers to their schools because they don't have transportation. And I asked him, how is that going to work if you combine all small schools together into one big one? It means some school will be even further away for some kids. And he promised that the ministry has already come up with a plan to provide a kind of transportation to the area where the road is accessible. So hopefully that will happen. The curricula also of the secondary schools will also be adjusted to the local needs, such as more tourism-related subjects in Phuket, for instance. But all in all, the thing is, when I talked to him yesterday, he didn't mention the word reform. But you can see if you have been listening to our report, or if you listened to the interview last night that we had with the minister, we were airing it last night. This is somewhere actually an education reform. And I hope it will work. It's a lot of work. I asked him, it sounds like a big project. It's a lot of work. And he said it is. He said it's not going to be easy, but they are working hard to make it happen. So now let's take a listen at some part of the interview. So as you can see that there's a lot of things going on at the education ministry. We had interview with him several weeks before too, asking during the political crisis, where there's a lot of students protest in front of his office, the education ministry. And he said there's a lot of things that he tried to answer to their demands, such as the regulations on their hairstyle, on their uniform. He has been negotiated with a lot of schools. He has proposed some kind of measures that will be a middle ground between the students, what student requests, and the school, and they're still talking about it, what would be the best way from both sides. Of course, hair and uniform is not the most pressing issues, but like when we talked before, that he mentioned the accessibility to education, the funding. He said that he is restructuring the budget management for all the schools all over the country. And he mentioned Phuket, that it will be a pilot project to combine smaller schools into one big one so they can share resources, and then we'll adjust the curriculum of the secondary school to answer to the needs of the local area. like in Chiang Mai or in Phuket will focus more on tourism, for instance. So that will be very interesting, I think. Now, let's go on to the next news. In case you don't know yet, Bangkok actually eases restriction on 13 types of business from Friday. So Bangkok Metropolitan Administration will ease the restriction of Bangkok 13 types of business to reopen today with strict disease control measure in place. And the Bangkok administration lists all the 13 type of business. There are game arcades, but all points of contact must be regularly disinfected and face masks worn at all times. Also, internet shops is allowed to open. Senior nursing homes with limited activities. Sport venues, except for boxing rings and racetrack, but no audience allowed. Banquet venues, they are allowed to open and organize some event, but if you will have more than 300 participants, you need to get authorization from the BMA. Amulet shops and markets, beauty salons, tattoo and piercing shops, fitness centers, but they do not allow a personal trainer or no communal steam rooms. Spas, Thai massage shops, excluding massage parlors. Gymnasia and boxing venues for training only. Bowling alleys and ice skating rinks, but no competitions or audiences. Dancing academies, martial arts schools, but no tournaments or audience allowed. Though there are some businesses that still remain closed. Those are night entertainment venues, playgrounds, theme parks, snooker clubs, cockfighting, fish fighting, and bullfighting venues, massage parlors, child care centers, nurseries, and tutoring schools must, however, remain closed. So that is what's going on with Bangkok. A lot of things starting to ease up in the lockdown, but like all the officials said, that they have to wait and see what will be the numbers in next couple weeks. Like Dr. Tawisin said, that the number might rise for Bangkok in next few weeks because they are doing proactive screening in a lot of factory grounds. But if it's not like total of 500, 600, maybe they will keep easing measures further. Now, let's talk about vaccine. There's a lot of news about vaccine today. And let's go to this first. I'm showing you AstraZeneca, but actually we had a drama about the vaccine before. AstraZeneca did the technology transfer agreement with the Siam Bioscience in Thailand, and there were questions by politicians how this company get it, whether there is something going on, is it got special treatment or what. But then this is not much in the news. I don't know why. 2 days ago, the one department of the Public Health Ministry actually said in a press conference that AstraZeneca, Thailand proposed several organizations, including the pharmaceutical department in Thailand, to be the partner to produce the vaccine in Thailand. And the only one that was chosen by AstraZeneca is this Siam Bioscience. AstraZeneca said that Siam Bioscience has enough capability and technology and know-how to produce these vaccines. So there you go. That is the explanation given by the government. They said not because of any special treatment, but that AstraZeneca is the one select this company themselves. Anyway, let's go to this news. 50,000 doses of AstraZeneca vaccine to arrive in February. The Public Health Minister Anutin Charnvirakul said that the first 50,000 doses of AstraZeneca Oxford vaccine will arrive in Thailand in the first week of February, coming very soon. The minister said that the doses are part of the batch of 26 million secured by Thailand at 150 baht per dose. This shipment is not the same batch to be produced by local firm Siam Bioscience under the technology transfer deal with AstraZeneca. He also said that more vaccines would arrive in March and April. The 26 million doses are the first lot that Thailand agreed to purchase in October last year, while negotiations on the price for another 35 million AstraZeneca doses are still ongoing. Anutin said, Thailand still does not have enough vaccines since doses procured so far are only enough to inoculate 30 million people. But like we reported before, the government hasn't really finalized the inoculation plan yet. So we don't know whether it's going to be half population got 2 doses, or there's some suggestion from some experts that they can do 2 doses for high at-risk group, like medical personnel and people that work in high-risk area. And then the rest give 1 dose to everybody in the country, including immigrant workers and foreigners. But we will see. The plan will roll out pretty soon because we are getting vaccine and they have to start the inoculation pretty soon. Anyway, the health minister, Anutin Charnvirakul, said that he had volunteered to be the first person in Thailand to receive the AstraZeneca vaccine. And Dr. Yongpu Virawan, a virologist at Chulalongkorn University, Faculty of Medicine, who we quoted numerous times, will administer the vaccine to him. The other vaccine ordered by Thailand is CoronaVac from China. The company called Sinovac. It's still pending registration in China. And AstraZeneca's vaccine is likely to be registered in Thailand first. So we'll see what will happen. A lot of countries already start the vaccination program already. Lots of them in, especially CoronaVac, lots of them in the human trial phase. But AstraZeneca also has been administered in many, many countries. There was some news about severe side effect, but the Prime Minister said before that he will only start the inoculation project and allow these vaccine to be used in Thailand only when he's sure it is safe. So we're going to wait and see. Even though when we get vaccine already, you have to just adhere to these measures, wearing masks, washing hands frequently, and keeping distance to others, and limited your movement and activities outside the house. Anyway, and that's all the news in this edition of Thai PBS World News Update. You can get news all day from us on our website, thaipbsworld.com, on our Twitter, just search for Thai PBS World, on our Facebook, also just search for Thai PBS World. We have the news not just on COVID-19, the political news, the business news, some news from ASEAN, some interesting news, a lot of in-depth analysis and explainer. Anything you have curiosity about, especially politics in Thailand, I think we have an answer for you. Anyway, and see you guys at 7 p.m. We have another version of the news update with me and Nat Punnak. สวัสดีค่ะ